Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the secondary glaucomas, now we have um, inflammatory glaucoma. Okay, now this inflammatory glaucoma can be due to uveitis. This is inflammatory glaucoma due to uveitis. So here this inflammatory glaucoma due to uveitis, it can be of two types. Three types actually. In the uveitis, there is formation of posterior synechiae. Whenever the posterior synechiae are formed, what is this posterior synechiae? Now, this is the cornea, this is the iris. Now because of, and this is the lens, right? Because of the iris getting attached, having the iris will form adhesions with the lens. So as a result, the right, whenever the iris will have adhesions with the lens like this posteriorly, it is forming synechiae, that is adhesions. So as a result, the aqueous humor which is formed here cannot go through the pupil, because of this adhesions the pupil is completely blocked. So the aqueous humor which is produced in the posterior chamber cannot reach the anterior chamber, and thus it cannot be um, drained. Okay, and along with that, because of the synechiae, there is synechiae formation are seen even here in the angle also. So as a result, because of these posterior synechiae, the patient will develop angle closure glaucoma, that is secondary angle closure glaucoma will be developed along with the pupillary block. So there is secondary angle closure glaucoma has been developed along with pupillary block. So this is one type. And second type is there can be anterior synechiae also. Whenever there is anterior synechiae, here it is the same picture, but here the problem is this is not posterior synechiae, but now here there are anterior synechiae are present completely here. And now because of this anterior synechiae, the pupil is normal, the pupil is completely normal, there is no block, but here the angle is blocked. So due to anterior synechiae, here also there will be secondary angle closure glaucoma will be seen, but this secondary angle closure glaucoma is seen without any pupillary block. Okay, because there is synechiae or fibrosis is formed, or adhesions are formed between the iris and the cornea, resulting in the closure of the anterior chamber, closure of the angle. Then we have last type, because whenever the uveitis is associated with inflammatory cells, so from the uveitis the aqueous flare cells and all the aqueous cells which are formed, these will cause block the trabecular meshwork. So these cells, here the cells are going to block the trabecular meshwork. So this is a type of secondary open angle glaucoma. So if you see, due to uveitis, there can be development of both angle closure glaucoma, and there can be development of open angle glaucoma also.
thank you and thank you for watching.